real thing at the end of the day is that we are responsible for solving our own problems. And if we are going to do meaningful research that really addresses our own problem, it has to be done by us. Because of lack of environment for people to really thrive, because it's not just about collecting salary. A lot of people are immigrating. So the question is, how then do we immediately arrest this brain drain and get people to really do something meaningful? And that was the whole essence of starting the NIMR Foundation.
Hello and welcome to another episode of the Break It Down podcast by Nigerian Health Watch. Like the name says, this is where we break things down because health affects all of us, so we need to understand it better to make sense of it, to ask for better healthcare. So essentially the podcast helps us to break these things down and amplify the voices, the people who are also working to make the health sector work for all of us. So yeah, I'm really excited for this episode.
Woo!
Are you?
Chibuike, I feel like you need to say your name.
Maybe because it's the excitement that's making me forget. But yeah, you already know. I mean, if you're part of the Break It Down community or village, like we call it,
I've never
you know
called
that
us
this
a village.
This is one of the mayors of the Break It Down podcast, Chibuike.
And I am Asari, okay, your original co-mayor of the Break It Down town. I have never called us
maybe an election
a village.
Okay. Maybe a county.
Yes.
So on today's episode, we are diving into an important but often under-discussed topic, building local research capacity and why it is a critical piece in strengthening Nigeria's health system.
Yeah, absolutely. And like I said, the whole idea of the podcast is to, have these conversations, simplify them, but also bring the people who are working, who are the front lines of, making health work for us. And we have one of them here with us today. Interestingly, we're recording this in Lagos. First time we're recording it out of our base. Hopefully the next one will be in Geneva, in New York,
Fingers
in
crossed.
South Africa, in
Hunger,
all over.
call me.
But yeah.
Let's skip it to Nigeria.
Okay. Well, in Sokoto, in Abia State, in Uyo. But I mean, go around, go where the stories are.
New York should call me. I'm ready.
But yeah, really excited to have an amazing guest today, Dr. Sobande. I hope I didn't.
Sobande.
Okay, thank you very much. He leads the Nigerian Institute of Medical Research Foundation, and we are here to learn about his work and how it's helping to move, the health sector forward.
Mm-hmm.
Welcome
to the show.
Thank you for having me.
Great.
Really
okay, so let's start by setting the stage, right? Why is local research capacity so essential to improving health outcomes in Nigeria?
Okay. I think the way you generally say it is that you don't expect other people to build your health system for you. Mm-hmm. And if you are going to do meaningful research that is going to drive your health outcomes, it has to be owned by the people who are going to use it, both in terms of conceptualization, implementation, and how it is put out for people to use. So, for example, there are disease conditions and health-related situations that are applicable or maybe are general across the world. But for us in Nigeria here, there are things that are very context specific and things that only apply to us. So say you talk about malaria.
Mm-hmm.
Yeah.
Although in other parts of Africa, we have the issue. But malaria is very endemic right here in Nigeria. And if you're going to solve the problem, we don't expect the global north to be the one to solve the problem for us.
Yeah, absolutely.
They have no incentive to do it. Onchocerciasis,
Sorry, what is that?
Sorry.
Break it down. You got that one.
I'm sure that you walked on the road and you've seen people with this swollen foot, where you call it's filariasis.
Yeah.
So they have lymphatic filariasis. The common name that they call it on the streets is what again?
Is it
Elephantiasis, yes.
Sorry, I went to school.
So if you look
why
at
I'm
all
mayor.
of those issues, the real thing at the end of the day is that we are responsible for solving our own problems. And if you're going to do meaningful research that really addresses our own problem, it has to be done by us. But beyond all of that, if you're also thinking of health systems issues, maybe whether you're talking about policies or implementation strategies, implementation of evidence that we know are very context specific. What works in America may not necessarily work for us. So if you're going to contextualize it and operationalize it in such a way or make it work, for us, we need to look at the context.
Yeah.
They are context is very key, and that's what I want to bring out.
Okay.
So at the end of the day, doing local research is important for improving health outcomes. And when you look at health outcomes, it's not just about how people feel. It's, when we look at health generally, we talk about the social determinants, meaning that the health of people is affected by where they live, where they work, where they play.
Okay.
Meaning their everyday normal situation. To a large extent, investing in local research beyond actually solving the problems, it's more like like an endless cycle that keeps going around. So if you invest in local research, people are able to, number one, you are investing in the economy of that place. It's beyond health. You are investing in the environment. It has a ripple effect on every other thing if you look at it. For example, just look at the situation when we had COVID. There was a whole market around, beyond the COVID vaccine itself, there was a whole market around production of syringes, needles, adjuvants, and the other, cotton wool and things that you need to administer.
Face masks.
To be able to administer all the. So there's a whole ecosystem or built around these things that goes beyond the direct investment that you look at it. And so if we spend money and if you take time to actually build a local research ecosystem, it's as effective even beyond health sector itself.
Yeah.
And improves the overall well-being of people. So human capital development, very key.
Essential.
On the table. Yeah.
Awesome. Thank you so much for those insights. So Asari asked the question to set the stage, but I will also go back a bit before setting the stage and, ask a bit about the story of NIMR Foundation, right? Because for this to happen, all of what you described, someone has to be at the forefront. Someone has to be at the, the driving seat. So can you tell us a bit of how NIMR Foundation came to be and what specific gaps that it was, you've been designed to fill as far as, research is concerned in the health sector?
Okay. NIMR Foundation is a child of necessity. Like the name, Nigerian Institute of Medical Research Foundation. It was started by the institute itself to address specific problems that they've identified. And in Nigeria today, one of the key things you find, especially in the health research and development space, number one, as a country, we are grappling with the triple burden of disease. So we've always had the common communicable diseases here: malaria, HIV, tuberculosis, the common guys that we know about. Then we have non-communicable diseases like cancers, cardiovascular heart disease. You've heard of stories of young men just falling down and
in the middle of playing football.
Yeah.
Just dying.
Sure.
So those are the double. And then we now have the triple one. The third part of it, which is becoming where you have injuries, both intentional and non-intentional injuries. So you're talking about road traffic crashes, violence that is going on and claiming lives. You're grappling with all of that in the midst of underfunding a health system that is grossly underfunded. And then you have researchers that you put in place to then do research and address those problems without actually giving them what they need to actually do meaningful research. So typically every year we did a review even when we were starting. We did a review to
When?
see. Oh, that was sometime in 2022
Okay.
when we were trying to do some advocacy.
Okay.
And we reviewed for the last 10 years how much has been given to the institute in terms of a budget line.
Yeah.
Remember, budget, not the actual.
But exactly.
For research itself. So there's the part where you have in government budgeting, there's the normal part of personnel, overhead, and all of that. Meaning that you're just paying salary, keeping the research facility running. But the fund for people to do the actual work, the median for those 10 years that we did was just around 110 million.
Wow.
The question is, what are you going to do with 110 million? For example, if you're in a lab where you need to do analysis, you need to do, for example, you take samples in the field and you then need to run genetic sampling. To know what the genetic makeup of that. A genetic analyzer, for example, 3,500, cost about $90,000 to bring it in. I'm not talking about consumables. So if I buy one, it means I've expended the entire money for the year. Because that money is not even enough to buy that. At the current rate, maybe at the old rate, it was enough. It's not enough for me to do anything meaningful. So what people typically would do in such scenario is just do research for the sake of advancing their progress. Maybe knowledge, attitude, and practice. Not really meaningful research that addresses the health problems of the nation. So, and then, of course, because of lack of environment for people to really thrive, because it's not just about collecting salary, a lot of people are immigrating. So the question is, how then do we immediately arrest this brain drain and get people to really do something meaningful? And that was the whole essence of starting the NIMR Foundation. And our thinking was just that, can we raise money from the private sector first and start using that to build capacity for people to be able to do meaningful research, provide some grants, small grant for people to do work. Then, on the other hand, then do advocacy and go talk to the people who make decisions about budget, about allocation, and say, can we improve the funding for healthcare research in Nigeria? And then when you do all of that, hopefully be able to, so we don't think that this is a short-term stuff.
Of course, yeah.
This is a long-term investment to really reverse the situation of our time.
Okay. So let's talk about the landscape for health research in Nigeria now. What are some of the main barriers that are stopping people, right, from actually going into early career research? Like what are the things that are stopping them when it comes to, say, like securing funding, mentorship, and then opportunities to lead studies?
Okay. I think that's the whole essence of the NIMR Foundation.
Of course,
we do. At the end of the day, you realize that, just take the situation, for example, in NIMR, since we are trying to break it down. So I will not use all my big grammar. So people come in as research fellows here. And this applies to other research institutes and academic institutions. They come in with their first degree, you employ them. But typically, if you are working in a research institute, maybe a master's, because you need to show. And then you need to do a PhD. There's no funding for your PhD. Meaning that you need to bring money out of your pocket, the mega amount that you're collecting as salary, and then use that to fund your bench work and all the things you need to do. So first on the list is funding. Funding is a big issue. And which is why the environment abroad is very different. Nobody does a PhD with their own money. Standard. There are scholarships, there are grants, there are awards for people to actually come in and do their work under the supervision of a senior person who will put them through. So they are learning and doing the work going on at the same time, and also learning how to get grants. So the problem we have here is that we are not getting that kind of funding for people to be able to undertake education, get the competencies they need to be able to do proper and quality research. And then they're also lacking in terms of mentorship or clear arrangement or systems that actually help them to develop in a way that they can do something that is meaningful. Because these things, to a large extent, is both an art and a science. So there's the science of it, there's also the art of it, and it's about the systems that you create to actually do that. And then, of course, there's a huge disconnect with the marketplace. So you have a lot of research going on that is actually not influencing policy or actions in the real healthcare systems, because they are not set up to do that. And so those are the kind of things. So when you look at it, when you define environment, also the environment matters. And when we're talking about environment, we are talking about, okay, do you have the lab space to do the work? Do you have the mentorship? Do you have a structure in place that helps you to build? Because oftentimes for a lot of people, it's not just about the lack of money. It's also about the structure. So I come in, do I understand how I'm going to progress in my career? Am I doing something that is meaningful? If I come in and I say my passion is to really do research, am I doing something that I think I'm actually changing something or influencing something? So all of that actually work together to form some of the biggest barriers that people face, and oftentimes the reason why people leave.
Wow. Interesting. I'm actually curious about two things that you've actually mentioned. So first is, when you have, I forgot to ask it as a follow-up question, when you sort of outlined why NIMR exists. So I'm just curious to know, since that time, what are you seeing? What results have you been seeing so far? Any changes, just, briefly? And also something you just mentioned now, that disconnect between the actual research and practice change or policy change or use. So why do you think there is that disconnect, that continues to exist between the research and actual implementation?
Okay. So I'll go with the first one. Okay. And the first one is that when we came in and we were able to raise the fund, we did the launching of the foundation in 2021, November 4. We raised some money, about 350 million. It was far less than our target. Our target was to raise 10 billion. But the market said something different. And it's also to tell you also, because while we were doing all of this, we also went around public sector trying to see if we could also see things, some leeway around the public sector to actually fund this. Because the big idea is that we wanted to do capacity building and provide environment for people to be able to actually do research. And what were we thinking? We're thinking that we'll take that 10 billion, put it in a trust, and basically be able to do training and do capacity building on a long-term basis. So when we're talking training, we're talking about three things.
Okay.
I mentioned that for most people who come in, one of the biggest challenges that they have is funding their PhD and medical fellowships. For clinicians, they go through residency and all of that to be able to get training. And then for non-clinicians, they do PhDs. But oftentimes people do both. So be able to do PhDs here locally and supplement that with travel grants for people to travel for conferences, present your papers and all of that. And also then do postdoc placements. You finish your PhD, postdoc is for you to get the opportunity to have hands-on experience on your own and become an independent researcher. So, on one hand, and then we also thought of doing training on grantsmanship, meaning that we are telling people how to, because everywhere all over the world, the only way you progress as a researcher is by getting grants to do work. And your grants are typically tailored to what you are interested in working on. So we thought that we could do that. And that's exactly what we've done over the last 4 years since we started. So we started with a 21-day residential training on grantsmanship, basically telling people how to look at it from the need for mentorship and collaboration across disciplines and across institutions and across sectors. Because quite a lot for research that people do, they do them in silos here, not interacting with the other people and trying to find. So that connect between the academia and the industry or the government to create that, and then also get them to the place where they are able to write high quality proposals that can actually win funding from local and international organizations. So we've done that over the last, this is the 4th edition that we're doing. What we found is that, of course, we are a learning organization. Okay. We've also found that there are some things that we needed to change. For example, one of the key things that we changed was the format. So we turned it from just being residential and turned into a fellowship program where you're actually providing mentored capacity building effort over time. So we realized that it's not enough for you to teach them for those 3 weeks and then let them go. What we now do is actually find mentors who are working in their area of interest and attach them to them for a period of 1 year. So the mentors not only look at what are the trainings that they need and help them identify and get it, but they also supervise the proposals that they're coming up with and ensure that at least within that 1 year period, they get a funding, a start. And then, sometimes all you need is just that start and that push.
Yeah.
And then you're able to get others.
Okay.
Yeah. In terms of the disconnect that you talked about, the disconnect is because of the way things are currently structured. To a large extent, they are structural and they are cultural. Meaning that for the most part, if you look at the way academia is aligned, the interest and the timeline, I can call it timeline and incentives. For people who are in academia or research, they are more interested in long-term research, building something along a particular line. Whereas for policymakers, or for example, a frontline healthcare worker, they need answers. Short time, they need it now and they want to get it now. So to a large extent, the interest or the incentive, then those who are in the research, to a large extent, are doing it for career progression. Most of the time, the way the incentive is structured is not such that they are making real world impact. And then, if you look at it, also, I mentioned people working in silo because there is no reason, no incentive for me to. So if I'm measuring your performance based on the fact that how much impact have you contributed to how things actually work, it's a different ballgame as opposed to counting the number of papers that you are first author, second author, or last author. Very different. And also, there's limited or no co-production. People to a large extent are working in silos. So researchers are sitting in the ivory towers, doing their own stuff. Policymakers are in the ministries and doing their stuff, or in the hospitals. The healthcare worker is there doing his stuff. So, to a large extent, they are not asking the policymakers that what are the research problems that you have, or what are the real life problems that you are facing in implementing the health system as it is. And so there's that disconnect. And then, of course, over time, one of the other things you also see is that the way research is written and done is the communication aspect of it, just like we are talking about break it down. We talk in very technical terms that policymakers may not be able to and there's less emphasis on knowledge translation. Knowledge translation meaning that people are published in different places. So, for example, maybe we are talking about how best do we treat diabetes. Researcher A in institute has done this, another researcher has done something. There's nobody really focusing on how do we aggregate all of these evidences and come up with a solution to say that based on this is actually the best approach to treating this, based on research from A, B, C, D, E, and F. And that's one of the things we do. So we are teaching people how to actually do systematic reviews and be able to aggregate evidence and use that for... So breaking all of this, breaking the barriers will require that we begin to change how researchers are rewarded.
Okay.
Meaning that the requirement for promotion needs to then factor in how much of real world experience you are bringing into your work, how you measuring impact in the real world. And then we need to focus on co-production, meaning that whatever research you are doing should not just be at your own, something you are just thinking of. It should be based on the question, what is the health research agenda for Nigeria, for example? If we answer what the health research agenda is for the country, then every researcher who is doing work should be picking from that to inform what they are doing. Okay. And then, of course, that part of implementation science, that oftentimes the result that you found, how do you then use it to affect what people do every day, maybe in the clinics or at the ministry or all of those things.
Okay.
So it's really a lot to unpack.
It is a lot to unpack.
Yeah.
I think you've also sort of touched on my next question, which focuses on what you think it would take to make research more attractive, right, to people in the health sector. So if you could, because a lot of us, we know about brain drain, and you mentioned brain drain, we know about Jackpot syndrome. I had a doctor 2 years ago look me dead in the eye and say, look, Asari, this is the last time I'm going to consult with you. I'm going to the UK next week. You will not see me again. Right? So what do you think it will take, right, to make careers in research, especially in the health sector, more attractive to our people?
And I think that's what NIMR Foundation is about, actually. So it will require systemic changes, meaning that, number one, and people need to do something that pays well and that is meaningful and that they are passionate about. So if we've established that they are passionate about this, then maybe it's the other two that we need to look at. Funding for healthcare research. There's a lot that we could talk about funding. And I tell you the example that we did. You know, there was the World Health Assembly Declaration of 2005, which says that at least you should spend 2% of the health budget on research. Our health budget is nowhere near that. The health budget for 2024 was somewhere around 1.47 trillion out of the 28 point something trillion. It was about 4.something%.
Yeah.
The total allocation for health research out of even the low health budget. You know that the low health budget itself is even 4.5. I mean, it's very far away from the 15% that was agreed, the Abuja Declaration.
Yeah.
Yes.
Out of the 4.5%, what is actually assigned to health research itself is way even lower. We are just talking about budget. We are not talking about release.
The actual release, yes.
So funding for healthcare research needs to go up dramatically. And we've done a lot of advocacy about this. And the interesting thing is this, 2023, we were at the Ministry of Budget Planning and, to get to really lay the case and say that we need to fund healthcare research. Okay, the minister said, okay, I'll give you 1 billion. But you need to find a way to get the legislators to actually approve it. Because I can put it on the budget, but they will slash it. We spoke with the legislators. They eventually approved the 1 billion. For the first time, 2023, NIMR got 1 billion just to do research. 2024 came, change of government. That money was slashed to 500 million. So we are even talking about that. That money is even gone down. We are not even talking about the actual release. Then you need to create an environment for people to actually thrive and do meaningful work. And that's why there must be that linkage between the research institute, the academia, the universities, and the market. Market meaning government ministries, private sector providers, such that it is co-production of research. So I'm funding research that actually helps me solve my problem. Because in one sense, I can see the output of what you're seeing as a government or a private sector. I can see the impact of it. And then I'm incentivized to fund it more. And then you, on the other side, you are also solving real world problems. And when you combine all of that together, it actually makes for, it helps things on the overall. And more importantly for us at the foundation, what we are trying to do at the end of the day, the end point actually, beyond all the training in grant writing, systematic reviews, is to go to the point of innovation and start getting commercialization, meaning that you actually get molecules or products, technologies, vaccines that people are making right here and are able to produce to actually solve our problems. That's where we are. And that is the end goal, actually.
Is there, or are there any like specific areas that you think are particularly overlooked in medical research in Nigeria? So like, say for instance, infectious diseases or mental health, or I don't know, malaria research, something. Is there any, or are there any specific areas that you think are particularly overlooked?
Yeah.
I wouldn't say that there are particular areas that are overlooked. I think all our research areas or agenda are generally underfunded.
Mm-hmm.
Okay.
The real problem is there's a saying that you put your money where your mouth is.
Absolutely.
If we are not serious, if we don't get the political will and exercise that thing to actually fund our own research, no one else is going to do it for us. So cast your mind back to COVID-19 again.
Mm-hmm.
When we had all of those issues.
Yeah.
The real issue is this. Remember that they only gave us vaccines after they have serviced their own people.
Of course.
Yeah. And
the question is, and the next pandemic is just
here.
around the corner. We got the vibes that the lawmakers were suddenly, so it was a case of, were you not aware? How can you be funding? How can you be paying doctors this? There was a whole lot of the panel, the committee that was set up. And we thought that energy was going to go on and people were going to fund. But we are back to our usual status quo.
COVID is coming.
But the next pandemic is just around the corner. Everything about the world shows us that globalization has been slaughtered. And everybody's gone back to nationalization.
Yes.
Nobody's going to care about us. We are the one who are going to solve our own problems. And, with the recent cut in funding from all of that, we really need to have a conversation as a people and really then say that we are going to address our own problems and solve our own problems with our own money.
I mean, that's really what I envision, a situation where even pharmaceutical companies are embedded in research institutes. I was happy when I saw something biobank here. So because I see a lot of that when we have opportunity to travel. You see Pfizer, you see them embedded in research institutions. So those researches are going from research to actual product. So, but I mean, in all of this, I imagine it's not easy. It doesn't come with its fair share of challenges. So what are some of those key lessons or hurdles? I don't want to really, dwell too much on the challenges. So I could take them as, if you had to call them lessons or hurdles that Foundation has passed through since you began this journey.
Well, I think I'll go with the lessons.
Okay.
For us, one of the key things I emphasized was that we realized that we needed to make this more immersive, in the sense that we needed to get people beyond the train into hands-on stuff. So we attach you to a mentor to actually take you through that journey. And then secondly, I mentioned funding, even for us as a foundation. One of the key things we told ourselves we were going to do when we did the first fundraising and we didn't get how much we thought we were going to get was that let us produce proof of concept, so to say.
Okay.
With the little we've got, let us see what we can do in terms of impact. And that's exactly what we are doing. And then now showcase that and now use that to tell people that, okay, if government can take this up and continue to fund research, especially capacity building for research, because those two are connected. You need people to do research, but you also need to make sure that you are doing workforce development that actually, more like a pipeline for people to continue to have the skills and the competencies to be able to do research. Yeah. Those are some of the things that we identified in actually implementing this. And then, of course, that to a large extent, we also need to establish an environment that actually favors some kind of philanthropy or commitment to greater goods among our people. Oftentimes when you talk with people about funding research, they look at you and then the question they're asking is that, okay, so it doesn't involve building a structure that people can see. and say it in my name.
Then
No,
take
we are saying
20
Ndawiche
kilometer road.
to yes. I mean, we told somebody we went, to one of the big institutions in Nigeria, and we're talking with them, and then the person was like, okay, so I take 2 billion and then I'm not going to see anything. I'm like, that's how
Wow.
first of all, it's an invisible, it seems like you're putting money in an invisible or in an abyss. But then that's the process of building things, and then it eventually comes out in patents, in products, in vaccines and technologies that you can actually use later on. So these are long-term stuff that oftentimes looks like you are investing in something that is not visible, but eventually it comes out.
It is indeed.
Wonderful. So I think our final question today is, what's next for NIMR Foundation? Are there any initiatives, any opportunities that we can look out for, that our listeners can look out for?
Oh, yes. So we do this every year now, at least for the foreseeable future. We have the funding for that. We do the grantsmanship and mentorship training program. And we even have, typically our advertisement come out early in the year, around January, February. And then the cohort then goes through the training for next 1 year. We have a cohort that is, they are learning how to do systematic reviews, manuscript writing, and then eventually to cap it, they will come for the grantsmanship training in August. Another one is coming out next year. We think we'll be able to do this for the foreseeable future. And at least if you get 30 people trained every year. And the interesting thing about these 30 that are going on is that they actually go on to their institution to actually establish the same kind of training.
Interesting. So step down.
So they are stepping it down. They are actually teaching their students how to do it, because most of these people are also lecturers, apart from being researchers. So they are teaching their postgraduate students, they are teaching undergraduate how to do this. And if we have a whole bunch of people, a crop of people, a cohort that are able to do this, I think the future is very bright for healthcare research in Nigeria.
Yeah, absolutely.
I think so too.
Yeah, thank you so much, Dr. Sobande, for sharing this amazing insight. And not easy, but really showing that, it's one step at a time, really. Just to say thank you and keep up the amazing work that you and the team are doing at the NIMR Foundation.
Thank you so much for
Thank you
having
so
us
much.
and helping us to say this. At least,
I love it. And thank you to our listeners, everyone who tunes in to the Break It Down podcast. If you enjoyed this episode, please make sure to like, share, and subscribe. Break It Down is on all your favorite podcast platforms. Chibuike, where do you listen to Break It Down?
Mostly Apple Podcasts.
Oh, same.
Yeah.
Who listens to it on
But
Spotify?
it's on Spotify, it's on the web.
It's even on your website.
Yes,
Yeah,
it
it's
is.
on the website as well.
All right.
So until next time, keep asking questions, keep pushing for progress, and keep breaking it down.
Woo!
Thank you so much.
Thank you. Peace. Yeah.